Welcome to Horizon Medical Education. I'm Minnie, one of the medical directors, and over the next few weeks, we are getting to know some of the people who have joined us in partnership. I'm delighted to be able to introduce my guest today. He is the legal representative and clinical officer of the Rwandan Medical Clinical Officers Organization, Nathan Rutatina. Hello, Nathan, and welcome.
Thank you very much. So let me start by giving a brief notes about how I became a clinical officer.
That would be really fantastic.
So, in Rwanda, we've got a system where students, before studying their undergraduate level in universities, they are invited by the real university where they are admitted to be presented about the courses in that exact university. So it was then when I was a part of new entries that were invited to be presented, the courses that are available at that University of Rwanda.
Yeah.
The courses included clinical medicine and community health that delivers clinical officers.
Yeah.
The dean of the school presented the course to me, and then I got convinced and I decided to take the course because it was so going with my goals, long-term goals, in relation to playing my role in fixing some of the problems that do exist in the healthcare system of Rwanda.
Okay. I mean, how long ago was this, Nathan? When did you become a clinical officer?
Yeah, I became a clinical officer in 2016, and I became again licensed clinical officer, and later on I went back to advance my studies, where I became a public health specialist.
Okay. So where did you work as a clinical officer? Was it in Kigali or somewhere else in Rwanda?
I worked with Rwanda Biomedical Center in the division of non-communicable diseases as a professional internee. And later on, I went back to school, as I mentioned earlier.
Yeah.
And then after doing that course, then I went to the Ministry of Health, where I worked in the division of clinical and public health services.
And tell us a little bit about how the Clinical Officers Organization came into being.
The Clinical Officers, or Rwanda Medical Clinical Officers Organization, started following a need of conducting three things. One is advocacy, advocating for clinical officers, since it was a new program.
Yeah.
Not only that, but also protecting that exact profession. And the third thing is to enhance the capacity related to clinical knowledge of clinical officers.
So sort of education for clinical officers, is that right?
Yeah, education, but most importantly is maintaining their skills that they acquired from the university and the hospitals, and again to advance them from one level to another, such that it can result into good healthcare service provision to patients.
That's fantastic, isn't it? So a really good supportive network for clinical officers. But clinical officers are relatively new in Rwanda, aren't they? So how did it become a profession in Rwanda?
Yeah, it's a new profession. Let me deeply talk about how it came into existence. After a very deep scarcity of medical doctors in the country. And then this program was produced because it is a program of medically accelerated trained clinicians that can fix a gap or can work in the absence of doctors.
Yeah.
So there existed another big problem where there was unnecessary transfer of cases from health centers to district hospitals.
Okay.
Maybe to understand that problem, I will tell you about levels of health in Rwanda.
Yeah.
We begin with the community, then to health post, to health center, to district hospital, provincial hospital, and then to referral hospitals.
Okay.
So the level of health centers, it is usually run by nurses, and the district hospital run by nurses and doctors.
Yeah.
So there existed unnecessary transfer of cases that could be managed from health centers
Yeah.
they were transferred to district hospital, and later on could give a luggage or an overwhelming work to doctors.
Yeah.
Which sometimes results into a healthcare service provision that is not of quality because they could be overwhelmed by patients.
Yeah, absolutely. So overstretched.
That problem actually had to be fixed by bringing on board another new profession, which is clinical officers. Clinical officers lie in between a nurse and a doctor, and they've got skills that are so advanced in a sense that if they are placed in health centers, there is something that can be done in strengthening the primary health care system.
Yeah.
Resulting into reducing unnecessary transfer of cases to district hospitals, and also the primary prevention in the communities.
Yeah, I mean, the primary healthcare in the communities must be
Yes,
huge.
So clinical officers were designed to fix that problem in the country.
Yeah. How many clinical officers are there approximately, do you know?
Yes, currently we are approximately 382 in the country.
Gosh, that's good, isn't it? Over 7 years. So the training's what, 3 years, is it?
The training is actually, it takes 4 years.
4 years, sorry.
Yeah, it takes 4 years from the University of Rwanda, and a student is given skills. So that means a clinical officer is capable of performing clinical skills or improving the life of a patient.
Yeah.
And not only that, but also a clinical officer is able to have managerial skills, then we call it leadership skills,
Yeah.
to manage health facilities, most especially the health centers.
Yeah.
Yes.
So what do you see as the priorities of clinical officers in Rwanda that your organization wants to address?
Yes, some of the priorities, as I mentioned earlier, actually is the capacity building.
Yeah.
In terms of acquiring clinical skills or maintaining the knowledge, and not only maintaining the knowledge acquired from the university, but also to enhance that exact knowledge.
Yeah, and keeping up to date, of course.
Yes, and keeping up to date, getting the knowledge that is, to practice in an evidence-based situation.
Yeah.
Yes, please.
Absolutely. And how are the clinical officers able to keep up to date or to maintain their skills at the moment? How does that happen?
Well, there's one way, as I mentioned earlier, advocacy. Yeah, also to seek partnership, partnering with other organizations or platforms that can provide these skills. Maybe I'll be straight to the point. We have a partnership with Horizon Medical Education.
Indeed,
and,
yes.
Yeah, Horizon Medical Education has been playing a big role for clinical officers to have online courses. I'm saying this because we've been through the pandemic, and clinical officers couldn't be able to have face-to-face courses.
So do you think technology is helping here?
Yeah.
Is it available for everyone to be able to use the internet? And I mean, what's access like in Rwanda at the moment?
Yeah, technology, of course, is very important. There has been some few problems related to internet issues, but our government, actually, we are thankful to our government because our government has tried best to make, actually to almost cover the whole country when it comes to having internet.
Yeah.
Yeah.
Is that through mobile internet?
Yes, mobile, smartphones. So people just buy bundles at an affordable prices, and then they can be able to access those online courses. And later on, they are given certificates. Those certificates are very important when they are presented to Rwanda Allied Health Professions Council.
So you have to prove that you're maintaining your skills.
Yes, so for your license to be renewed by the regulatory body that is in charge of clinical officers, you have to present the certificate that actually clinical officers have been getting from Horizon Medical Education. And their license get renewed. Not only that, but the most important thing is that they get skills. Besides having the gold certificates, but they get skills.
Yeah,
and
exactly.
It has been so proved because we've got some clinic officers heading health centers in the country.
Yeah.
And they are really doing good.
Brilliant. I know clinical officers, as we discussed, are a relatively new profession in Rwanda, but the whole world has been working out how to manage the COVID-19 pandemic in the last couple of years. I was wondering if you could tell us a little bit about the part that Rwanda clinical officers have played in the Rwandan effort to manage coronavirus and to keep the healthcare system running alongside it when it's been so overwhelmed with the extra work.
Okay, so Rwanda Medical Clinical Officers Organization is an umbrella that covers all clinical officers in Rwanda. So we developed a partnership with Africa Medical Supply, and currently, even now, clinical officers are playing a role that they have been playing even before. And that role is about mass testing of communities and what we call the drive-through testing, where we, in Kigali, we put our tents somewhere on the road and then we go on stopping buses, and then we test those people from traveling. We do that in conjugation with the police, the traffic police, and then people get tested. So we do that because it is in the line of surveillance of COVID-19 to see if there are new other cases, and then this gives a picture of what to do next. So not only that, clinical officers have played a role in vaccination of the public. And even today, they are playing a role in the vaccination.
Yeah.
Again, something else maybe I had to mention first is I give an example of myself. I played a role in case management, where I was a part of the team of managing the critically ill COVID-19 patients in treatment centers. Other things that clinical officers did, did during the pandemic, they include rapid response. They could evacuate patients from their homes once their testing results could come positive. They could evacuate them from their homes up to treatment centers. And another thing that was really very important, and they could do it properly even because of the readings of Horizon Medical Education. Actually, they performed what is known as home-based care practitioner.
Oh, fantastic.
Where when COVID-19 patients could get sick and then they could stay in their homes, but clinical officers could play a role of visiting them regularly, communicating with them, and giving them medications where necessary. Making a follow-up on them.
So monitoring them during the illness.
Fantastic, yeah. They could monitor them while in their homes. For those who could show that they need another intervention that is in the treatment center, they could again play another role of communicating with others such that that patient can be transported to a treatment center for further management.
So would that be for things like oxygen and?
Yes. When it could require oxygen therapy, then they could get transported by an ambulance, then up to the treatment center for further management. But they really did a great job during the pandemic.
Yeah.
And even today, they have continued to perform well. And the partnership that we have with Africa Medical Supply, as well as Horizon Medical Education.
Yeah. No, it's fantastic. I mean, sharing knowledge and sharing skills is so important.
Those are the few things that our clinical officers have played in the mitigation of this pandemic in the country.
Yeah, so it's clear they've played a major role in managing this. Do you think that it's helped to support the case for medical clinical officers to be accepted as a core part of health provision in Rwanda?
Yeah, clinical officers are accepted to work in the country. It is proved by the official gazette that was published in 2018, where they are accepted to practice in the country. playing a role in the COVID-19 mitigation increased a trust that officials have, had for this profession. Up to an extent that not only the government institutions, but even the local NGOs today, they feel like they can work with clinical officers. So activities of clinical officers have made an advocacy that is so tremendous.
That's fantastic. I know the work that we do at Horizon is offering primary care education mainly, but also I know that in some countries, clinical officers are specialists as well. So there's a primary care clinical officer, but you might also have a surgical clinical officer or an anaesthetist clinical officer in some places. Is that the case in Rwanda as well? And if not, is that something you'd like to develop in the future?
Definitely, it would be something very important. You know, in other countries, this profession is more than 3 decades old.
Mm.
In my country, it is only 1 decade, actually not even a decade, but we are hoping to have that in the near future, because it would be very important to have our members acquire more knowledge. For example, like in pediatrics, like internal medicine, like in gynecology and obstetrics. It would be very, very important to the country. To not only the students, but even the country in general. So that is one of our strategic plans, of which we think we shall achieve through partnership. We are so pleasured and so pleased to have you as our partners, and I'm sure that there has been something good when it comes to acquiring more knowledge and skills to our members.
It's been fantastic chatting with you today, Nathan. Thank you so much for giving us some of your time. It's been really insightful into life as a clinical officer in Rwanda, and we wish you all well and look forward to carrying on working with you in the future.